Hi, I'm Dr. Jarrod Frank, Director of the Fifth Avenue Dermatology Surgery and Laser Center. Today we're going to talk about the various treatment options for fat. We've had a lot of great innovations over the last several years. We do a lot of fat removal in our practice here, about 300 liposuction cases a year, and now with new novel technologies like smart lipo, vaser liposelection, powered liposuction, and now the newer cool sculpting and Liposonix non-invasive technologies, we have several options to offer patients. One of the most common questions that we see today are, which is the best treatment for me? And all fat is not created equal. People come in different shapes and sizes, and ultimately removal of fat through surgery or non-surgical methods truly aren't for people who have weight issues. We do these procedures to get the last bit of weight that can't be removed through diet and exercise, and to help genetically bred trouble spots that people just can't get rid of throughout the years. What I want to focus at first is on the totally non-invasive technologies. It is a new hot topic, and there's a lot of confusion about what is available. The two biggest technologies now are Zeltiq, or cool sculpting, which uses a freezing type of technology on the skin which will melt fat, where the body can then absorb it internally. We use that in the earlier stage of our practice, but now with newer technologies like Liposonix, we have replaced that. The goal of these techniques is how to trick the body to melt fat and absorb it without doing surgery. And ideally, both technologies are similar in efficacy. What you can achieve is about an inch on the waistline if you go all the way around. The technologies penetrate about a centimeter into the skin and remove a layer of fat of about a centimeter as well. So for people who have significant amounts of fat, it's really not going to be appropriate technology. But patients who are thin and really just need a little bit off the sides, the belly, the inner thighs, the knees, or the abdomen, we certainly can get a good response. Now, that does not mean, because it's non-invasive, that it has zero downtime or is totally pain-free. Although they are non-invasive, you can have some mild soreness or swelling of the area for a few days, maybe a bruise. The procedures can be slightly uncomfortable, but here at our Fifth Avenue Dermatology Surgery Laser Center, we offer whatever level of sedation that is needed, either oral or topical, or through injection to keep our patients comfortable. We are an accredited surgical facility here, so we could offer most forms of sedation, which is why I think this is the right place to come, given the options and the capabilities that we have. I want to demonstrate the Liposonix device. This is really the hottest new thing here. It uses ultrasound as opposed to the cooling that was done before. We make our settings, and it comes in a stamp, so we're really able to sculpt out. The cool sculpting, or Zeltiq, is a suction cup that goes on the area, which very much limits the sculpting process. You're always going to be ergonomically limited by the areas you're treating and the size of the device. But with the Liposonix, we could really pulse it in however many areas we want and sculpt out the body shape. It is a little bit more uncomfortable to get, but again, it's a quicker treatment, and we can make patients as comfortable as they need to be. You can do an abdomen and a love handles area in about an hour, so we say about 1 inch in 1 hour. It does take about 8 to 12 weeks to see the results. Regardless of what technology you use, you have to rely on the body's ability to absorb the fat and break it down. So what we do is we make our settings here with different shapes of the applicator, so we can get around the belly button or smaller areas on the side. And what we do is the machine does most of the work. Once we do our test spots, we just basically let the device sit on there. We do spray some cooling water on the area, and we just let it sit. I'm not going to run it on my hand. And basically it's 1-minute pulses. So the machine just sits there, it does this thing, and then we move it from area to area around the body. And we do that about 3 or 4 times, depending on the area or the place and the size of the area that we're treating. Again, the most common question is Liposonix or Zeltiq better for me than smart lipo or vaser or some of the more surgical options? And the fact of the matter is, again, everyone is different. The advances of some of the other lasers and liposuction options is that we're able to actually melt the fat underneath the skin. So we give minor sedation of sorts, but patients are totally awake. They're able to go to the bathroom. We infuse local anesthesia into the area, and through very, very small holes that close up without stitches, we put a laser or an ultrasound or a little powered electric toothbrush device under the skin to melt the fat. And then once the fat is melted and the heat is placed under the tissue to tighten the skin, we use small micro cannulas, which are about the size of a long Q-tip, to gently massage it out. This is a very minimally invasive procedure. Even in my larger patients, they're back to work in 48 hours, most of the time without any bruising or without any requirement for prescription pain relievers. You do wear like a Spanx-like garment for a couple of days, but nothing like the old traditional techniques where you have significant downtime, bruising, and chances of skin irregularities. It's a very safe technique and offers often the best option for patients to get rid of significant amounts of fat. So again, the main metaphor is that the non-invasive options are more for teacups of fat that need to be removed, whereas the minimally invasive liposuction options like Smart Lipo and Vaser are for people who need actual soup bowls or even like a liter or two of fat. So if you picture, if someone needs about a liter of Coca-Cola's worth of fat removed, they're going to certainly do better with liposuction. What's important now is that we have several options, several safe options that could be formed quickly, safely, cost-effectively, with minimal to no downtime. And we're proud of the fact that we offer all of these technologies at the Fifth Avenue Dermatology Surgery and Laser Center, as this is a very, very large part of our practice. So if you have any further questions, please look at our website, www.pfrankmd.com, to see more information and videos, and certainly if needed, book a consultation. We'll be happy to talk to you about your options.